And welcome back. Well, he's a leader in the field of fertility and reproductive medicine, including surgery and in vitro fertilization. Today, he has some exciting news for couples looking to have a baby. Dr. Mark Surrey, welcome to the show.
Thank you very much.
Quick question, how is it some fertility clinics have a higher success rate than maybe others?
There are two reasons. The first reason is the success of a center is contingent upon the quality of its laboratory, and there are different levels of laboratories around the world. The second really is the function of success rate is a function, as you know, of who you're measuring it by. So, for example, older women are not going to conceive as often as younger women. So you have to look at the age, and you have to look at the number of embryos that are replaced. So if you look at a clinic whose average age is 38, you're going to have a different success rate than a clinic whose average age is 28.
Oh, that makes sense.
Yeah.
Well, tell us more about your unique method of ensuring that you have a successful embryo.
There are different philosophies about that, but the technology now has advanced so rapidly over the last decade that we have the abilities now to assess embryos critically in a laboratory. We used to just place embryos on an early stage back into the patient, and we no longer do that because we have the ability to test embryos structurally as well as genetically. We're giving a paper actually here at an international meeting on a new technology called an embryoscope, which allows us to continuously, over 24 hours, 7 days a week, monitor the development of the human embryo from its earliest fertilization. And that allows us to differentiate embryos which are normal from those which are not normal. And as we age, there's a greater percentage of human embryos that become abnormal. And if we eliminate those, we decrease miscarriage rates and we increase implantation rates.
Okay, so you look at the progress of the embryo, and at that point, a successful embryo is seen, then you can implant it to have a successful pregnancy.
Exactly. And we can also differentiate and get higher pregnancy rates with single embryo transfers, thereby eliminating or minimizing the incidence of multiple pregnancies.
Okay, we have a video that we will show you later. We'll put it on our webpage for you to see. If you want to find out more about Dr. Mark Surrey, all you have to do is go to the website right there. We will also have that available at KMIR6.com later on, so you can see more about his procedures. Also, he was talking about the 61st Annual Pacific Coast Reproductive Society. It's an event that's already underway. It's at the Renaissance Esmeralda Indian Wells from 7 to 9 tonight. So it's all day, and you're going to be there today. So where can they find you?
We're going to be lecturing on this subject in about an hour.
In about an hour. So get on out there. We want to thank you so much for joining us this morning.
My pleasure.
Well, very fascinating what you're telling us.
Thank you.
Time right now is about